Well, chances are you've dealt with it before. You wake up in the morning and your voice is raspy, or you're just squeaking trying to get the words across. But is all of it coming from cheering too much of the Jaguars game, or could this be an actual infection? And we turn to Dr. Kalpana DiPasquale. She is here with some advice. She is the founder and physician at St. Augustine Ear, Nose, and Throat. It is so good to see you again. Thanks for joining us.
Thank you.
Okay, so let's talk a little bit about this, because you have been seeing a lot of patients coming into your practice with this problem, hoarseness.
Yes, and believe it or not, football season does have something to do with it.
Yes, it does, especially if we can squeak out a win.
Oh,
first
yes.
Time. People are going to be very hoarse probably seeing
People
you
are
on Monday.
hoarse, they can't talk afterwards, and what did you do over the weekend? Oh, I was cheering at a football game. Okay, there we go.
There we go. That one I can diagnose.
Exactly.
But beyond that, what do you think are the causes? Because you have been seeing so many people coming into your practice with this problem.
There are. One of the most common causes of hoarseness is, of course, laryngitis, which is typically what we see after the football game, screaming, yelling. We get swelling of the vocal cords. But there are other things we need to be concerned about as well. If you're not sick and you have hoarseness, we got to worry about things like cysts, vocal cord nodules, polyps, a hemorrhage of the vocal cord. So there are a lot of other things that can be going on. And last but not least, cancer has to be thought of as well if you're smoker or drinker or those kind of things.
So this is not something to take lightly. If you're suffering from a persistent problem, then you should be coming in to see someone such as yourself.
Exactly.
What is causing this hoarseness? What is going on in our throats?
Well, what happens is, the vocal cords are small, delicate structures. So, when they're working properly, everything sounds great. But if you get a little bit of something going on, either they're not coming together as well as they should, either they're swollen, they're inflamed, any of those things can cause issues with the voice. We also see teachers, people who use their voice all the time, people who do TV, radio.
Yeah.
Those are the ones, people who sing for a living, those are the people that are most commonly afflicted with problems.
So if I'm having a problem with this and I come and see you, and how are you going to diagnose if this is something serious, if it's something minor that maybe I should just stop talking, which I'm sure a lot of people would like that around here if I would just stop. But then, and then what are some of the treatment options? And I guess it's all depending on what the problem is.
That is so true. So we have a device in our office called a video stroboscopy. It's a little tiny camera that goes in through your nose and down into your vocal cord area. I know it sounds terrible, but it's not that bad. It's actually very comfortable. My kids have had it done. So
well, if the kids can do it, then
you can do it. Absolutely. So what it does is it puts the vocal cords in slow motion. We're actually the only practice in St. Augustine area who has this machine. And what it does is slows down the vocal cords just like a strobe light in a disco, so we could see real subtle irregularities that we couldn't see if the vocal cords are vibrating too quickly.
So once you do that, then you can diagnose then if it's a serious problem or if it's something minor. Is that right?
Exactly. That allows to visualize. And the biggest mistake that's often made is people will assume that this hoarseness is caused by allergies, talking too much, doing this or doing that. It's best really to look, see what the problem is, then we know how to treat it accordingly.
It's better to be safe than sorry, for sure, because a lot of people, I know there is a young lady who works with us who was having some hoarseness problems and contributed it to allergies. So when we come in, how would you then treat if you find that it is allergies or if there's something more serious? What are the treatment options?
Well, allergies, we'd obviously just treat the allergies, but for example, if it was a vocal cord nodule, which is a common thing that also occurs in people who overuse their voice therapy can be very, very effective for that. And then surgery is always an option. If you've got something like a polyp or a cancer or a cyst or something, then those things are surgical issues that need to be dealt with.
And then when should somebody see you? When should we come? At what point in time after day 2 of the hoarseness should we say, okay, I need to say something after these days?
2 to 3 weeks if it's persistent, because if you're sick and you have a cold and you're hoarse, most likely it's all related, and that's not a big problem. But if it's persistent and it's not getting any better, it's been 2 weeks, the studies say 2 to 3 weeks. I would err on the side of 2.
Yeah,
I'm a big better safe than sorry person.
Absolutely. It does, it's better, as you say, to get in and see a doctor. And then any advice in the closing seconds here about preventing hoarseness? I mean, obviously, if we're going to the game on Sunday, well, we got to pull out a win for the Jaguars, so it might be worth it in that instance.
Right.
But beyond that.
But, minimize it as much as possible. It's important to breathe when we're talking. Some people forget to breathe. That's a big one. Staying hydrated is huge. The more hydrated the vocal cords are, the better they work. So those are a couple of little tips that will really, really help you along the way.
Okay. Dr. DiPasquale, it is so good seeing you again.
Good seeing
thank you for coming back.
You.
We appreciate you, and thank you to Dr. DiPasquale and the advice and for sponsoring this segment. You can book an appointment or learn more about St. Augustine Ear, Nose, and Throat by visiting saent.net or by calling 904-461-6060. You can also keep up with Dr. DiPasquale on Twitter by following her at Dr. K. DiPasquale, and you can see it's written there on the screen for you to jot it down and follow her on Twitter.